healthcare workers are facilitated to be able to fight against COVID-19. Going forward, fellow Kenyans, all those who break the curfew rules will be assumed to have been in contact with suspected cases and hence will be quarantined for a period of 14 days. The government will hence carry out screening of truck drivers entering and operating in Kenya going forward. This will be done at roadblocks using a combined team of health and security personnel. All healthcare workers in both public and private facilities are required to wear protective gear as part of protecting themselves as they manage the patients. We have received disturbing news that some unscrupulous persons are recycling face masks after collecting them from bins and selling them to unsuspecting Kenyans. In particular, we've noticed the recycling of the surgical masks, and we've seen different pictures in social media. And we therefore say that this is unacceptable and this is actually criminal. Together with this awareness, we're going to be rolling out guidelines on the disposal of face masks, and we shall crack the whip on anyone found endangering the lives of fellow Kenyans for selfish gains. I urge Kenyans to undertake basic due diligence on face masks that they are buying so that they do not fall victim. And also we are calling on the National Police Service, the Kenya Bureau of Standards, the National Environment Management Authority, NEMA, and other relevant government agencies to come and take action on those who are recycling masks and selling them to unsuspecting Kenyans. While still on this case, we are witnessing another unbecoming phenomenon, where people are assuming that using a face mask alone can beat this virus. We've seen cases where people are walking around, not observing social distancing and feeling that the face mask is enough. Fellow Kenyans, the face mask only confers about 50% protection. So we still require you to observe the interventions that we've put in place. Yesterday, we witnessed a situation in Baringo where elected leaders led a mass demonstration in Cabinet Town, thus endangering the lives of the locals. What we saw in Baringo must be condemned in the strongest of terms. Fellow Kenyans, remember, under the Public Health Act that has been invoked by the Ministry of Health, all gatherings, whether political or religious, remain banned. We have also noted that there are people who are presenting all manner of letters of authority to be able to move out of restricted areas. It is important for people to note that nobody has the authority to clear any person to move out of these areas other than the Ministry of Interior. We have also noticed that wines and spirits have been converted into drinking joints. These facilities are only licensed as takeaways only, and therefore we urge any Kenyans who may be visiting the wines and spirits to buy any drinks to ensure that this is a takeaway service only. And anyone found drinking at the wines and spirits shops will be arrested and the businesses will be closed down.